VitreosHealth, Beyond Insights.
That with all the changes in the healthcare, in the payment model, as well as the whole proactive preventive care, the role of the patient is changing. It's no longer the patient coming to a clinic or a physician. He is becoming more of a consumer of healthcare resources. So under the new payment model where the focus is shifting from the patient to the population, now the provider needs to reach out to the patient. In effect, the patient has become a consumer. So then when you start looking at a patient as a consumer, then the whole new dynamics come into place. If you look at the consumer industry, or whether it's the Procter & Gamble's or Coca-Cola's, they look at the different consumers. They start segmenting the consumers. What are their needs and how do we deliver our end product to have a totally different experience customized to that segment of the market. I think the same thing is going to happen. You're going to have analytics being used, whether it's predictive or using population analytics to start segmenting this patient population into different segments, trying to identify the unique requirements of theirs based on clinical risks, socioeconomic risks, access to care risks, and come out with a care management offering that is so tailor-made to that cohort of population that you have the highest return on the investment you're making. And that is the level of analytics, incorporating the predictive nature and the algorithms you're building. We are trying to take the whole population management programs and the care management plans. Everyone at our company loves what they do, because for us, when they look into the analytics, a data point is a patient, a life that they can impact. And I'll give you a very good example for one of our customers who had signed up for a patient-centric medical home. We were doing the analysis and we found out, as we were looking at all the patients who had more than 3 ER visits over the last 1 year, and then looked at their clinical risk and it was low. And we started mining the data and we found out a significant portion where patients who were abusing pain medication. And that type of an insight, and then taking the data and finding out where are they coming from, is it socioeconomic related, is it access to care related, and then helping our providers put a care management program addressing that. Helping them by to start lowering the costs and increasing their reimbursement revenue based on this new at-risk model. I think that's what gets excited, is where we are increasing the revenue for our customers and at the same time bending the cost curve at a national level. And for us, every data point is a life that we are impacting. There are 5 tenets that we are building our company on. The first is anything we do has to have an impact on the customer results. And how do we do that? We need to build innovative solutions and come up with answers, better prediction, better outcomes. And the third is, how do you make it convenient for our customers to use it? And the fourth is, got to be responsive. If a clinical team member, whether the physician and the nurse, calls us and says we need to run this report, we should be able to turn it within an hour to deliver that report to them, and whatever, through a smartphone or even send them through the desktop. And finally, how do you make it affordable? Because we feel that there is about 50 to 60% of the market that is not a part of an IDN, and they still want to be independent and want to play this game, the new payment model game of taking risk, whether in ACO, commercial or Medicare, and patient-centric medical homes. And those are the tenets under which we are building this great organization. We are very excited with what we are doing, with the growth that we have seen over the last 1 year. And what makes it really exciting is when we see the future. Currently we have a lot of accountable care organizations, the Medicare organizations sign up with us, patient-centric medical homes, some managed care organizations taking risk. But if you really look at it, right now only 5% of the population is under some form of at risk, and it is expected by 2018 about 75 to 80% of the population will be under some form of a risk contract. And you're talking about nearly 250 million population. That is a huge opportunity for us, and we want to be one of those few players who will leverage that opportunity and be a success story during this transformation.